watch this video before it's removed from the internet.
In 1926, they came out with a booklet about how to use sodium bicarbonate as a medicine. Sodium bicarbonate is probably the most useful substance there is. There are books that talk about hundreds of common uses: cleaning the refrigerator, dealing with diaper rash. The list is endless. As a medicine, it is crucial. It also, as a medicine, is the least expensive medicine there is. You can buy 50 pounds for less than $50. So we're talking very inexpensive because it's common baking soda. And yet in injectable form, you have to have a license to use it. Though it's very useful taken orally and transdermally, like in baths. In fact, it's so useful, I put it in between my toes to control toe fungus in between my toes. Baking soda is a very flexible medicine, like magnesium. It can be taken orally, it can be used transdermally, it can be injected, it can be nebulized. And there's a company that makes a capsule that combines sodium bicarbonate with glutathione. Break open the capsule and put it into the nebulizer, and you're directly treating the lungs. It is not very well absorbed through oral means, so this transdermal route is a very powerful tool. I recommend sodium bicarbonate baths. Usually I recommend 1 pound or 2 pounds in a bath. I've had people write me have used up to 5 pounds. And they told me the bicarbonate was coming out of them for 2 weeks afterwards, so I wouldn't recommend so quickly that kind of level. But starting out with 1 pound of sodium bicarbonate and 1 pound of magnesium chloride bath flakes or dead sea salt. People have been using for years Epsom salt, which is magnesium sulfate, which is okay, but it just doesn't, the medical effect is not as strong as using magnesium chloride. So these baths are very, very nice. Orally, for cancer, I'm the only doctor in the world who's written a book, a full medical review on sodium bicarbonate, on the simple baking soda. And I always suggest it to be part of a protocol for cancer. This is a very important point because there are many reasons to sustain, and quite a bit of clinical and experimental science to sustain Dr. Tullio Simoncini from Rome, his use of sodium bicarbonate in treatment, also in the treatment of kidney disease, also in the treatment of diabetes. In fact, we find that in the 21st century and in the century before, with all of these toxins combining in the face of our nutritional deficiencies, people have become acidic. The modern or normal condition of human beings or of our patients is they're acid. Their whole environment is acidic.